Hey there, welcome back to How to Medicate and welcome to this new video where we will discuss borderline personality disorder, how to treat it and how to possibly improve it. This video is part of a video series on mental health problems, and for those of you who want to keep on learning, you can check out the playlist in the description later after you have watched this video. Now, for those of you I'm meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because here we believe that medically educated people make healthier decisions, which is the whole point of this channel. Therefore, this video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, always contact your own doctor. And now quickly, let's get learning. So in this video we will cover how to treat borderline personality disorder and how to possibly improve it. But before we do so, I thought it would be important to exactly explain what borderline is. As the name says, it's a personality disorder. And as a mental illness, it is classified by chronic instability. Instability in thinking, feeling and acting. This often causes unstable relationships, a distorted sense of self and strong emotional and impulsive reactions, which can lead to self-harm and generally dangerous behavior. Other symptoms might be a feeling of emptiness, a fear for abandonment, and detachment from reality, sometimes in the form of dissociations. Borderline itself is quite common. About 1 to 2% of the Western population has it, and it's equally common in men and women. It's still unclear how borderline is caused. However, it is believed to be caused by a combination of factors. Biological ones, like your innate impulsivity or mood lability, psychological factors like growing up in an unstable household, abuse or attachment problems, and social factors like again being born in the Western world. Borderline itself typically starts in early adulthood and stabilizes at the age of 30 to 35. And symptoms might also decrease with age. Medical studies have therefore demonstrated that 3 years after your initial diagnosis, 40% of patients did not meet the borderline criteria anymore. And after 15 years, 75% did not meet them anymore. So borderline is certainly not a chronic illness in all cases, which is hopeful. However, sadly, about 10% of all patients dies prematurely by suicide. Which brings us to treatments. And here I want to mention that the most important factor in improving quality of life and decreasing symptoms is age, not treatment itself, as borderline stabilizes from age 30 and onwards. Therefore, treatment should also be aimed at the stabilization of borderline itself, so patients can get a grip on their own lives. Therefore, treatment goals should be twofold. First, it should focus on learning patients to control their borderline through crisis management and stabilization. Secondly, it should also be aimed at decreasing several of the symptoms and complaints of borderline. And there are two types of treatment forms which can play a role in the treatment of borderline: psychological treatment and the treatment through drugs. The most used psychological treatments are cognitive behavioral therapy, dialectic behavioral therapy, and verse training. It will be no surprise that the behavioral therapies focus on the behavior of a patient, in which difficult events out of daily life will be practiced, so a patient can learn how to cope with these events. This can lead to new positive experiences, and several studies have shown the effectiveness of these behavioral treatments. Verse training, on the other hand, focuses on the regulation of our emotions, where it helps patients to recognize and adapt their emotions and negative thought processes. And as mentioned, doctors might also prescribe several drugs in the treatment of borderline. However, none of these drugs are specifically registered to treat borderline. These are mostly used to treat the symptoms of borderline. Antipsychotics can be used to reduce anxiety, anger, confusion, and impulsivity. Antidepressants can be used to reduce mood swings, aggression, and self-damaging behavior. And anxiety medication can be used to reduce anxiety, impulsivity, and distress. Now, I hope you learned something and I hope you found this video helpful, because educated people make healthier decisions, which is the whole point of this video and actually my entire channel. For those of you who want to keep on learning, check out the playlist in the description, or I will put a link to it up there. Now, all that's rest me is to thank my sponsors on Patreon. Thank you, Sebastian, who's an investor supporter, and thank all of you for watching. Before you go, please leave a like. This will help out the channel tremendously. and consider subscribing so you will never miss such an awesome medical video again. Oh, and before you go, I recently made an Instagram account at How to Medicate. For those of you interested, check it out. And as always, I will see you next week with a new video. Bye bye.